So I think over the course of my career, what have been the major developments in PET imaging are the improved staging and also response assessment that we've been able to achieve with FDG PET, particularly in the area of hematological malignancy. So we realised very early on that using FDG we could get a much better idea of disease distribution in the patient than using what was traditionally used at the time, which was CT scanning. And in particular for haematology, what was important was that it gave us a much better assessment of distribution within the bone marrow. So importantly, what that has meant for patients is that it's meant that we have better staging, which means we can choose better treatments. And also what it's meant is that, for example, in many types of lymphoma, we can do away with bone marrow biopsy. We can now assess the bone marrow non-invasively using PET, and we can do away with the bone marrow biopsy, which is a procedure that many patients absolutely hate. Even more excitingly, as far as I'm concerned, is the use of FDG PET as an early readout of whether or not treatment is working for patients. And again, we realised very quickly earlier on that instead of waiting till the end of a course of chemotherapy, for example, and assessing the patient with CT, we could assess much earlier, halfway through treatment, so say 2 months into a planned course of treatment for 4 to 6 months, whether or not treatment was effective using FDG PET.